Hi, this is Dr. Tom George. I'm the CEO at MSMS, and I'm here today to answer some questions that have come up during the task force report on restructuring that the House of Delegates will be voting on at our annual meeting. So the MSMS Board of Directors has oversight over our finances, and despite our declining revenue and the changes we've made, which have been very difficult, we've continued to pass every audit over the last 3 decades without any problems or any infractions. Additionally, we have a finance committee that oversees our finances, a committee of the board, and we have an investment committee that manages our investments. So the board oversees our financial operations. So after 25 years of declining membership, it's really important to look for cost savings anywhere we can. These reforms allow us to take 3 steps. One is there are some direct reductions in cost. For example, costs associated with the House of Delegates if we don't have a House of Delegates anymore. 2 are indirect cost savings, and that accounts for staff time that is spent working on things that they would no longer have to do. Instead, they could concentrate on the important things for our membership, the advocacy, the CME, and policy work. And thirdly, the restructuring proposals would allow for a better value proposition when I, as CEO, try and sell memberships. It would allow us to have new pricing structures, for example, which I think would be very attractive to some of the practice groups that now dominate the medical landscape. So these changes would help us increase revenue because we would have a better ability to sell a membership. For example, we've lost dozens of large groups over the last few years, and it would allow me to reapproach them and sell them on a new value proposition. They wouldn't have to be obligated to have a county membership attached to the MSMS membership. So for some of them, that might be a difference maker. We've also had over 700 non-MSMS members take our CME courses recently. We could reapproach them with a better value proposition. And it also allows for creative pricing with groups, maybe partnerships with some of the specialty societies. So the restructuring proposals really open some new sales doors for us that would help pave the road for new MSMS memberships. So in addition to dues revenue, MSMS receives revenue from other sources. The main one of those is from insurance sales. MSMS has a captive insurance company, the Physicians Insurance Agency, but they sell insurance to our members, such as liability insurance, health insurance, other types of insurance. So that is a main revenue source for us. It's about 40% of our revenue. We have other non-dues revenue sources, such as management services that we provide to a couple other subsidiaries. All of these sources are important. They're all declining as membership declines. So retaining and adding new members is the key to growing MSMS's revenue. So the subsidiaries have experienced their own staffing reductions. They are self-generating their own revenue. And if we were to close them, we would lose the benefits, the revenue benefits that they provide to MSMS. So closing the subsidiaries does not help MSMS become more financially stable. They're actually adding to MSMS's bottom line. So all these reforms are important. The task force is asking the House of Delegates to approve them. If you have further questions, if anything is unclear to you, don't hesitate to reach out to me directly.